So here at the Metropolitan Sewer District of Greater Cincinnati, we manage 9 wastewater treatment plants. We treat on average about 180 million gallons a day across all those wastewater treatment plants. We have a number of industrial users across our footprint that we regulated by spot checking and sampling at random times. We didn't really have a great idea of what was continuously coming into our collection system, and that can be a problem because you have issues where if you don't know what's being introduced in your collection system, you can have problems with infrastructure protection where your sewers are breaking down over time. It can cause issues in your plants with upsets if you're sending things that are really high strength that kill off your biology of the plant. So we started looking for technologies to help us understand what we didn't know. The Conduit Pulse solution is a way to understand how your collection system behaves, whether it be through measurement of water quality or whether it be through how your communities are influencing what goes on in that wastewater. On the Pulse solution side, we have 8 different sensors that we use now and move around selectively to collect information in different portions of our collection system. But through the health department's work, we've deployed 16 more fixed sites, so we're collecting both community health information and wastewater quality information at these sites. We're actually finding great overlaps between these sites in where we are learning about industrial users in that area in our collection system that we've isolated that we didn't know about before. I can see in real time how a section of sewer is behaving, you know.
For us in public health, our job is to alert the community of when there is an abnormality, when there is risk of outbreaks and risk to the community. And so the wastewater data and looking at the wastewater analysis over time is one of those ways that we can do that and help alert the community if we see any abnormal trends, something that we see out of the norm. And I think where Kendu's help to come in is identify where we can find more targeted areas where we can determine detection at a more granular level than we have in the past. And I think that could, in the future help with public health and, and just general community knowledge and that greater situational awareness that we'd like to have for surveillance of communicable diseases.